How to pass a parental assessment in care proceedings. Proven steps and real stories. Imagine sitting in a quiet room, your heart pounding as a social worker flips through a file with your name on it. You want to say, "I love my child. I've changed. Please see me for who I am now." But you worry your past mistakes will drown out your voice. If this is you, know that you are not alone. Every year, thousands of parents face the daunting challenge of being assessed by professionals. Sometimes after a crisis, sometimes after years of struggle, sometimes after just one mistake. The process can feel overwhelming, even unfair. But it is also a chance to show your growth, love, and commitment to your child's future. My name is Chris Aniche. I am an accredited children's panel solicitor at Curling Moore Solicitors. For over 2 decades, I've stood beside parents in courtrooms and meeting rooms, helping them turn fear into action and setbacks into comebacks. This audiobook is your practical guide. You'll learn what professionals are looking for, how to prepare, communicate, and show through your actions and evidence that you are the best parent for your child. You'll hear stories of parents who have overcome addiction, mental health challenges, relationship breakdowns, and more. You'll get step-by-step advice, checklists, and real-life examples to help you at every stage. Most importantly, you'll discover that a positive assessment isn't about perfection. It's about being honest, prepared, and focused on your child's needs. Let's begin this journey together. Chapter 1. Understanding the assessment landscape. Assessments are not punishments. They are investigations to answer one question. Can this parent meet their child's needs safely and consistently? Types of assessments. Section 7 reports. Private law ordered in custody disputes to determine the best arrangement for the child's welfare. Example: a father regained contact by documenting his involvement in his daughter's school and completing a co-parenting course. Section 37 reports. Public law ordered when there are concerns about significant harm, to decide if a care order is needed. Example: a mother facing homelessness worked with housing support and provided a stability plan, avoiding a care order. Discharge of care order assessments. Used to prove sustained change and readiness for reunification. Example: a couple used therapy records, neighbor statements, and a family routine chart to show their home was now safe. What professionals assess? Professionals look for 5 key pillars. Safety: can you protect your child from harm? Stability: is your home and routine predictable? Insight: do you understand past mistakes and their impact? Cooperation: will you engage with support services? Child-centered focus: do you put your child's needs first? Action step: request the assessment criteria in writing. Tailor your preparation to each point. Chapter 2. Preparing yourself. Mind, body, and paperwork. 1. Mindset: acknowledge your emotions. Fear, shame, defensiveness. Talk to someone you trust. Write a letter to yourself or your child listing your strengths and progress. 2. Self-care: eat regular meals, get enough sleep, and stay active. Establish a daily routine for yourself and your child. 3. Organization: create a parenting binder with letters from school, doctors, or support services, certificates from courses or therapy, records of appointments, photos, and journals of daily routines. 4. Anticipate concerns, prepare evidence for any vulnerabilities. Clean drug tests, therapy letters, safety plans. 5. Practice role-play common questions with a friend or advocate. 6. Self-advocacy: bring a support worker if possible. Take notes and ask for clarification. Request written assessment criteria. Chapter 3. Building trust and communicating with professionals. 1. Be honest and consistent. Professionals value honesty over perfection. Admit mistakes and show what you've learned. 2. Communicate clearly, listen carefully, and answer questions directly. If you don't understand, ask for clarification. Use I statements, "I am working on," to show ownership. 3. Show engagement: attend all meetings, arrive on time, and follow through on commitments. 4. Example: Maria, who had a learning disability, brought her support worker to meetings and used visual aids to show her routines. Her openness built trust. 5. Handling difficult conversations: if you disagree, stay calm and explain your perspective respectfully. Offer evidence to support your view. Chapter 4. Demonstrating safe, effective parenting. 1. Actions speak louder than words. Invite professionals to observe positive routines. Bedtime, meals, playtime. 2. Use evidence: parenting journals, meal plans, photos of activities. 3. Addressing past concerns: show certificates from completed courses. Domestic abuse, anger management. Provide safety plans and evidence of changed circumstances. 4. Example: James, previously involved in domestic violence, completed a respect program, installed a doorbell camera, and provided a safety plan. Chapter 5. Tackling Specialist Assessments 1. Psychological and psychiatric assessments. Professionals may assess your mental health and its impact on parenting. Be honest about your history and current support. Provide letters from your GP, therapist, or psychiatrist. 2. Cognitive assessments. If you have learning difficulties, request reasonable adjustments, simplified questions, extra time, or an intermediary. 3. Example: Lisa, who had dyslexia, requested audio materials and practiced interview techniques with her advocate. 4. Challenging unfair assessments. If you feel misunderstood, ask for a second opinion and explain your needs. Chapter 6. Evidence, gathering, organizing, and presenting your story. 1. Collecting evidence. Medical records, school reports, support service letters, clean drug/alcohol test results. 2. Presenting evidence. Organize documents by theme, safety, stability, progress. Use a timeline to show change over time. 3. Witness statements. Ask supportive friends, family, or professionals to write statements about your parenting. 4. Example: the Ahmed family created a timeline of stable housing and school attendance, which was praised in court. Chapter 7. The Courtroom, What to Expect and How to Shine. 1. Courtroom etiquette. Dress neatly and arrive early. Address the judge as Your Honor or Sir or Ma, as the case may be. Let your solicitor speak for you unless asked directly. 2. Presenting yourself. Stay calm even if challenged. Answer questions honestly and briefly. Bring your parenting binder and notes. 3. Example: a mother practiced answers to tough questions with her solicitor, boosting her confidence in court. Chapter 8. Overcoming setbacks and staying resilient. 1. Setbacks happen. Missed meetings, negative reports, or mistakes are part of the journey. What matters is your response. 2. Managing emotions. Take time to process bad news. Talk to someone you trust. Journal your feelings and recovery steps. 3. Turning mistakes into lessons. Professionals respect parents who admit mistakes and show what they're doing differently. 4. Seeking help. Ask for extra support early if you're struggling. 5. Remember your why. Keep a photo or letter from your child nearby for motivation. Chapter 9. Your next chapter. Hope, growth, and moving forward. 1. Celebrate progress. Acknowledge your achievements and share them with your child. 2. Continue growing. Stay engaged with support services and maintain routines. 3. Give back. Join a support group or volunteer to help others. 4. Stay connected. Keep in touch with your solicitor or support worker for ongoing advice. Chapter 10. Frequently asked questions and final tips. 1. Disagreeing with assessments. Ask for clarification and specifics. Provide additional evidence. Request a second opinion if needed. 2. Bringing support. You can bring a support worker, advocate, or trusted friend to assessments. 3. Language and disability. Ask for an interpreter or reasonable adjustments if needed. 4. Keeping your child informed. Be honest but age appropriate. Reassure your child of your love and commitment. 5. Final tips. Stay organized. Be honest and proactive. Show, don't just tell. Use evidence. Keep learning and moving forward. Chapter 10. You are not alone. Share your journey. Congratulations. You've learned how assessments work and what professionals look for. How to prepare, organize, and present your best self. How to communicate, build trust, and demonstrate change. How to handle setbacks and keep growing. Remember, you are not alone. Thousands of parents have walked this path and succeeded. With preparation, honesty, and support, you can too. If this audiobook helped you, please subscribe, like, and share it with other parents who need support. Your journey can inspire others. For more help or to book a consultation, visit our website or call us. Thank you for listening. Keep believing in yourself and your child. The next chapter is yours to write.